So today is 2/11/25. Initials HW, complete en bloc. Nice lady. She is 36 years of age, from the Midwest, from the state of Missouri. And so she had her implants from 2015, what she said were saline. And on her exam, they did not feel like that. So this is her one and only set. So the one and only set that she had. So as you will see, I removed the excess skin, which is including the scar here. Full thickness helps with the contouring. I removed some inflamed tissue at the bottom part. But as you can see, look at the capsular tissue. It's very, very thin. Some inflamed tissue that I removed, and you can see some nodularity to it. And I'm going to actually cut right through it. So I'm very happy and content with how the whole dissection has gone. This is how it was sitting. And so this is where the breast tissue was above the muscle. So this is the fascia of the pectoralis major. So as I go in, you can see, look at the scar tissue right here. See this band? If I touch it, you can see these irregularities. So that's why I've had to remove this. You can see again over here, this is not good, healthy, fatty tissue. So as I cut through it, you can see it's like scar. And look at the way the capsule extends here. Look at this. And so this is not healthy tissue. This is all connective tissue, inflamed tissue. So what I'm going to do is, actually, let me go in from here. And you can see, look at the amount of inflammation that's present. Let me go in very slow here. So there we go, is the entry point. You can see how thin this capsular tissue is. No matter how thin it is, it has to go. So I'm actually going to take the ruler. I'm going to insert it right here so you can actually read it. And you can see how thin it is. And no matter how thin, it has to be cut completely. So I'm going to go ahead and use this kind of a guide, if you will. And you can see the capsules of substance as well. So it's an intact implant, and believe it or not, let me go in from here. You can see I cannot rip it with my hand. It has to be cut. And so these are not your saline implants. These are silicone implants. This is your Allergan 450. So relatively nice sized implant. And so 10-year-old set of implants. And the other thing I want to mention here is, look at this capsular tissue, so thin. I can put my blue glove underneath, and if I could put the ruler here, you can see it's transparent. No matter how thin it is, it has to go. And even if I try to tear it, I cannot. This is how thick this tissue is. It's very, very strong. And so all of this tissue has to go. Some areas are thick, some areas are thin. But total capsulectomy en bloc fashion, silicone implants, as was noted on the exam. And the patient certainly will be surprised that she did not have her saline implant, but this is the silicone implant. So what I'm going to do now is I'm going to remove my top glove, and I'm going to go to the left side. Normally, whenever you're opening the capsule, you have to put sterile gloves. I see some surgeons use non-sterile gloves, because if there's a biofilm on the inside that I'm going to get cultures off for aerobic, anaerobic, and fungal, you want to be able to get a good representative. So I have a new set of instruments. So you can see, look at this contracture band, if you will. And this is part of that. So en bloc on the left as well, the left side. You can see a relatively thick scar, and this was relatively wider. And you can see, look at the tissue around. This does not look normal or healthy. It has this connective tissue scar consistency. So I'm going to cut right through it. Again, very, very thick scar tissue on this side, which is the capsular tissue. And as I go in, this is your some fluid around. You can see that gel leaching. We didn't see much of it on the other side. So this is your 450 Allergan above intact implant, and you can see again, look how thin the capsular tissue is, complete removal, no breaks in the capsule, none of that internal small amount of fluid leaked out, and overall very happy and content with how the whole dissection has gone. And so nothing that I see that is problematic. So the implants will be returned to the patient as always. Capsules will be sent to pathology to rule out the BIALC, LCD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal, which I'm going to take shortly in between the implant and the capsule. And again, as you will see, returning the implants to the patient is very important for many reasons. Number one, there is psychological closure that the implants have been removed, that they were not ruptured, especially if they're saline implants. Number two, she can match them with her card. She was very firm that she had what are saline implants done 10 years ago, and it turns out she got silicone implants, and she will know exactly what was in her body. And this is where you never know till you actually have the card. I would tell you 10% of the time I have had discrepancies between the size, the volume. The patients have almost, within the 10% time they stated that the implant is much larger than what they had initially discussed. One patient had silicone in the past and saline on the other. One was above, another one was below. One was Allergan, the other one was Mentor. So discrepancies between the card and what was returned to the patient. Saline, the patient was thinking, and she ended up paying for silicone and vice versa. So a lot of discrepancies, so it's important to return the implant, and this is kind of part of those 6 criteria that I talked about yesterday on that Facebook Live that was very important. I suggest everyone should see. So there you have it. This is Dr. Khan, Executive Plastic Surgery.